Hi guys, welcome back to our videos which explain a little bit of information about what we offer here at the Richmond Wellbeing Service. Just a reminder, my name is Shauna and I am a qualified psychological wellbeing practitioner here at the service, which really just means that I've been trained to assess and treat common mental health difficulties. And I'm here with my colleague Veronica.
Hi everyone, and I'm a trainee psychological wellbeing practitioner.
Great. So this video, we're going to tell you a little bit about online CBT, and the program we use to do online CBT is our program called SilverCloud. So we're going to tell you a little bit about that program, how it works, what online CBT is, and how the reviews for that program really work as well.
Okay, so I'll start us off and tell us about the program itself a little bit. So firstly, I guess SilverCloud is an online psychoeducational program that is based on the principles of cognitive behavioural therapy. And if you want to know more about this specific type of therapy and how it works, please do check out our video about it. I guess one positive of online therapy is that it is, I guess, quite independent. It's teaching you to be your own therapist. And SilverCloud gives you the tools to be able to do that. So that's a really positive thing about it. Now, the way it would work if you did want to do SilverCloud is you would get a link to sign into this program. You would click on this link, you'd make your account, and this would make the program that you signed up to be available. So we do have programs available for several different common mental health difficulties like anxiety, low mood, and panic. So when you signed up, there would be several modules for you to work through, and each of these modules is quite interactive. It involves a whole host of different things. So some information about the problem, some tools and techniques for you to work through while you're in the program, potentially some videos, and then various things to take away and put into practice in your day-to-day life. And I can't emphasize the importance of this enough, really. Most of the benefit of this program will come from how much you are then taking these tools away and using them in your life. Now, these modules vary as you go through the program. So the first couple are quite introductory. Our first one will explain the program, how it works, how to work through it. Then there will be a couple of modules that are quite descriptive, giving you an understanding of the main problem. And then there'll be some modules focused on behavioural change, so how you can make that improvement. Each of these modules are about 50 minutes long each. And they can be worked through in various ways. So it's quite flexible. You could do these 50 minutes all in one go, or you could log in every single day. The program always saves your progress and you can always refer to things as and when it's needed. So it's very interactive and it can be tailored into a way where you find the way to use it that suits you best.
Great, really, really helpful, Veronica, thank you. I guess one question that comes up, and you have kind of discussed this a little bit, is why should I choose online CBT versus another treatment?
Sure, and that is a very common question and one that we get very often, I guess, mainly because when people have heard about therapy or they access therapy, this might not kind of fit their expectation. But it is actually an evidence-based program that has been shown to be as effective as the other forms of therapy that we offer. Therefore, if it's a therapy that suits your lifestyle, we would really encourage you to give it consideration. Now, what sort of lifestyles is this form of therapy best for? I guess it's very, very good if you're quite a busy person and you find it quite difficult to kind of chunk out some time in your day. So 90 minutes for our group or something in the day. The program, as I said, can be worked through very flexibly. You could do kind of 15 minutes every day. When you have some spare time, you could do it out of hours, which is something we're not able to accommodate for the other forms of support. So it is really something that suits busy lifestyles quite well.
Great, that's really helpful, thank you. And one thing about SilverCloud is that once we offer it, we do put our clients on a wait list. So they might have to spend a couple of weeks looking through the program without our support. And then what we do is we pick them off that wait list and then we book in those reviews with them. But some people ask kind of questions that what if they manage to finish the whole program before they get assigned that supporter to help them through it?
Sure. So I guess in short, that shouldn't really be a situation that you're ever in. And the reason for that is that our waiting list is usually 2 to 3 weeks long, so you'll be picked up within that time. Now, this might sound like quite a long time initially. However, we recommend that you work through the program at a pace of 1 module per week. Therefore, at the end of these 3 weeks, you're only likely to be maximum 3 modules into the program, which wouldn't be near the end. Now, this might sound quite slow at first, I guess, especially if you're quite eager to make a change and you're really looking to get going. It might be tempting to work through the program quicker. But as I said at the beginning, the benefit of the program comes from practicing these modules. So giving each module an entire week means that you can read the content and then really think about how to put the techniques into practice. Therefore, we kind of wouldn't recommend that you work at a pace where you finish in those 3 weeks.
Great, that's really helpful, thank you. So the next part we want to talk about, Veronica mentioned, getting set up on CCBT or SilverCloud, those different modules that are on those programs. So the way it works, as we mentioned, is you go onto a wait list once you've been offered the treatment, but we do get you set up on that program straight away. Once you come to the top of a wait list for the supporter, which as Veronica mentioned will be maybe 2 to 3 weeks, we will give you a call and we'll offer you what we call a review call. So that means every 2 weeks for between 4 to 6 reviews, we will give you a review either on the phone or on the program, and that will be us reviewing your progress. We'll be able to see everything you've chosen to share with us. We'll be able to see how far you've gotten with different modules, how often you've been able to log into the program, and any messages that you want to leave us. So we'll be able to give you some really good feedback on that and some really good guidance on maybe where to practice again or how to progress forward with that. So as I mentioned, there is either brief telephone reviews or online reviews. The telephone reviews are about 15-minute conversation where we really check in with how you got on the program that week and go through the modules with you. So you wouldn't really get much of a written review from that, but it would be more of a verbal review that you would get from the phone. The online reviews, you don't need to be actually available when we give those, but you do get a notification once we've uploaded that review, and that is a written review of everything you've done. So just instead of doing it over the phone, it's done on the program, which means it is a bit more flexible, as Veronica said, if you're busy, if you can't kind of fit in an appointment between the hours of 9 to 5. So yeah, that's how we offer the reviews for SilverCloud.
Thanks for that, Shauna. That's really, really useful. I do just have a couple of commonly asked questions that have been brought up by my patients. And the first one is that some people kind of are doing these reviews and they want telephone reviews so that they can explore their worries in more depth or just have a respectful space to talk. So I wonder whether you think a review would be appropriate for that.
Yeah, so we do offer telephone reviews, as I said, but they are brief conversations because most of the treatment on our online program happens on that program. So you'll be working through those tools and techniques, and our job is really to support you with that, to problem solve. We will, of course, check in. We'll check in with how you're doing, how your weeks have been, but it is more of a space to actually be able to think about the tools, how they've went, what went well and what was difficult, rather than to kind of talk about the worries or the feelings in more depth, really.
Sure, so it sounds like quite a structured space. Thanks for that. I guess another question that comes up is when people start, they're not quite sure what to expect, and what if they start with one type of review and it doesn't work for them and they want to switch to a different type? Would there be room for that?
Yeah, of course. So often that is the case. People aren't really sure what they want to go for. So we might agree to have the first review as telephone and then we'll move to online or vice versa. We will always do the final review over the phone, and the reason we do that is because we will want to discuss next steps with you. So whether you're finished with treatment or you'd like more support, which we do talk about in our video about the step care model. So yeah, there's no problem switching if you feel another mode would be better for you.
Fantastic, thank you. And then finally, I just wonder if people have a busy schedule and they don't feel like they can complete an entire module every week, and they might feel like they're not able to log in at all in some weeks. Would that be okay for them to go at their own pace?
So I guess, SilverCloud is flexible. It does allow people to go at different paces. However, what we know about therapy is it works best when we do it regularly. CBT, as we know, is a little and often approach, and everything builds on from the week before. So you're not going to get the same benefit if you're doing it kind of as and when, or every month or every couple of weeks, rather than being able to log in consistently. That is why we do offer you the review every 2 weeks. Of course, some weeks you might be a bit busier or things come up and and we're more than willing to discuss that with you, but we would be asking you to do at least about a module a week to get the most out of treatment and for us to be able to provide you feedback on that. So if that's the case, that it doesn't feel like the right time for you to be engaging with treatment, that is a conversation we can have with you. We can try and problem solve that with you at the time.
That's fantastic. Thank you, Shauna, and thank you everyone for watching our video on SilverCloud. If you did want to learn more about the stepped care model, what CBT or what other forms of support our service has to offer, please do check out our other videos, and we hope to see you there.